current and future mamas, welcome. This is Mama Matters, where we talk all things from bump to birth and beyond. Nothing is too weird or gross or taboo here. And motherhood wasn't meant to be done alone, so let's go on this journey together. Remember that you matter and your story matters. A quick disclaimer before we get going with today's program. I have been an occupational therapist for the past 15 plus years. However, this program and this entire series does not constitute direct occupational therapy services, nor does it constitute medical advice of any kind. So if you're experiencing changes or concerns with your body or mind, please contact your healthcare provider who knows your story and your history best. And if you're having a medical emergency, please call 911. Hi, everybody. I have with me here Akila Edwards, and I'm so excited. We go way back. We used to do a dance class together back in Florida, and gosh, I don't even know how many years ago that was.
A lot.
A lot
Like
of years ago.
maybe 11.
Yeah, yeah, something like that. That's
Yep.
crazy. So yeah, I'm super excited to interview you today, and let's get started. So tell me a little bit about, you, where you live, what you do, what's your family like, whatever you want to share.
I don't know how old I am. How am I? I think I'm 36, maybe. I'm going on 37. And I have two kiddos and a husband. My son is 4.5-ish something. And my daughter is 1.5-ish something. Their birthday is 4 days apart, so it's something.
Oh,
And I am a nurse in Gainesville, Florida. So I work at a hospital. And
that's so
that's kind of what I
awesome.
do. That's what I've been doing the whole time
Yeah,
for
yeah, I was
15,
gonna say,
like
I think when I knew you, you
15 years.
were nursing too.
Yeah,
Yeah.
15
What,
years, yeah.
yeah. What units do you work on, or what kind of nursing do you do?
I did med surg, but I'm in nursing education now.
Oh, cool. Oh, that's awesome. I love that. Awesome. Okay. Any fun facts about you? Anything that we should know that's, I don't know.
I'm crazy.
Aren't we all though? I mean, we all are. It's fine.
Yeah, I'm not a typical mom. How about that?
Okay. I love that. Maybe we'll dive into that a little bit. I love that though. Okay, so we're gonna just talk about all kinds of real life mom stuff from pregnancy to postpartum and beyond. We'll kind of go all over the place with different topics. But let's see. I have a list here that I wrote down. What would you recommend? So go like I think when we're first pregnant, at least in my experience, when I was first pregnant, I didn't really know what I needed for myself or for the baby. I kind of just went on recommendations from friends or like sometimes Google or whatever. Of course, mine are a little older, so back then we didn't have as much technology. But I don't know, like I didn't know what I needed. So can you make any recommendations for baby shower gifts, whether that's for yourself as a mom, your family, or for the baby that were like really useful for you?
Um, diapers,
Yeah.
diapers, diapers. Don't feel like you need all the clothes and stuff. Like you don't want to dress yourself in those weird clothes that people buy. So diapers because you could never have too many. With my first kid, I don't think we bought our first diaper until he was maybe like a year and a half, possibly.
Yeah.
Because that expense adds up. Like, moms can provide breast milk, hopefully, and if not, like hopefully there's some assistance for a baby to eat, but no one can provide diapers.
So true.
So,
And the outfit they outgrow so fast, but the diapers is like you
well,
need the diapers.
and not only the outfits they outgrow, but where do they go? They don't go anywhere but to the doctor's office. So they can just wear a onesie the first year of their life and just
So
be
true.
fine and swaddle them. So literally my kids live naked life in diapers. But
So
yeah,
true.
so
So true.
diapers, you can't have enough of those. And for mom, diapers, you can't have enough of those. When I was pregnant with my first one, um, I don't know, I went to a birthing class and someone in the group suggested like a women briefs, like postpartum briefs. And I was like, oh, I was like, I was gonna wear the whole mesh panty thing, but I tried it. Amazing. It's I so every person who has a registry, I tell them to put it on it, and that's what I buy. diapers
That is
per
so
mom and baby.
I love that because, and I've know it's funny because I've noticed recently I work in the hospital still with usually older folks, but that being said, someone had a package of briefs recently, and I was like, whoa, those are really comfortable. Those are not like
Oh,
those
they're amazing.
bulky. Yeah, they're like actually
Yeah.
like underwear. They're not bulky,
Yeah.
gross, like stiff things anymore. I
Yeah.
was like, ooh, I'm gonna remember that.
Literally. I have to put them in my Amazon storefront because I usually like tell everybody get some, get some. I gotta make some coins off of that somehow.
I know, seriously, you got to do some kind of affiliate or I don't know. No, but I wanted to make a point of that actually. I'm glad you brought that up because I think I can't remember. Did you say you're a C-section mama too? Or no?
Not a
Oh,
C-section,
you're not.
mommy.
Okay.
No. Mm-mm.
Okay, because I am. And so it's funny all the things that I like probably I feel like I should have known because I'm in the medical field too. But I didn't realize for me, postpartum, all of the fluids and bleeding and things that were going to happen even after a C-section. Like I kind of assumed like,
C-section.
oh, if you go through a C-section, you're not going to have all these things
I
happen.
literally just had two friends have C-sections last year, and they said the same thing. I was like, oh, I was like, I didn't have any of that. Like, I mean, I bought the briefs, but I didn't have any. So it seems that you have it more with a C-section
Maybe
because there's no normal funnel.
true. And I didn't even think of that back then. Like
Yeah.
you don't I was kind of laying there out of it and I'm like, oh, why do I need to have all these pads underneath me? And like, and it went on for a few weeks and I totally would have loved that recommendation. So thank
Yeah.
you for that.
Yeah.
That's fantastic. Yes, I love it. Okay, awesome. Anything that like, I don't know, wasn't useful that you got from baby shower gifts for yourself or for baby?
No, because I think I was very practical. Like I had no clothes, no anything. I just had bottles, diapers, briefs, breastfeeding stuff, and maybe like the elementary like primary toy type thing, but only like one or two. I didn't have a lot of anything on. I was very practical.
That's so helpful. I heard that advice from people and I did not take it. And now I'm like, why didn't I take it? That was like I had way
I
too
do
much
wish
stuff that
I
was
would
like,
have said books though. I wish I would have tried books.
ooh, yeah. And on that note too, I remember thinking books that they can have in the bath later when they're a little bit older, but they would
Right,
put everything in their mouth or it would get wet in the bath or whatever. And I was
right.
always like, things that you could put in your mouth that are
Yeah.
books would be great. So love that. Okay. Um, let's see. I have things written down from that we kind of mentioned a little bit before we got on here, but do you want to talk about fourth trimester recommendations? So for anyone who's newer to that topic or that concept, basically the fourth trimester is considered after baby's born. Your body is and baby are still going through all these transitions and growing together kind of thing. So even though baby has arrived, they're still learning to become a human, and your body is sort of starting to recover a little bit. So there's still some things going on that I think are not talked about, not to scare anyone, but just to sort of know that, like, okay, like a cutoff point of like now baby's, here. So that being said, did you experience anything in your fourth trimester that I don't know that you like thought would be helpful to tell other moms about or something along those
Yeah,
lines?
I usually tell all new moms, especially like being a nurse, so a lot of us are type A, that it's absolutely okay to let everything go. Nothing matters except for baby being fed and mommy being fed. That's literally all that matters. We can be stinky, we can, yeah, as long as we eat. And keeping a journal, even if it's not like a daily thing, but just brain dumping, because sometimes mom is there alone and dad goes back to work. Sometimes you're fortunate to have dad there, but he may not be helping. Sometimes there is, it just depends on what that support looks like, or you got in-laws in town and you wish they'd go away. Like it's a lot of feelings you go through in that fourth trimester. So I usually encourage people to journal it out. Like I still have the same journal that I used with my first, that I used with my second. I used it much less with my second because I went in with some some bearings. And I was like, nope, not gonna let that bother me today. So I want to say that's probably the biggest advice. Like it's okay to just do nothing but feed baby and feed mommy. It is absolutely okay. Everything else will get handled some way.
Yeah, no, that's so helpful, especially for us type A people, because I think it's almost like you have to have a mantra before baby arrives, like it's okay. It's okay to let things go. Because I really struggled with that. Like really.
Right. Yeah, I was in a very dark place with my firstborn because of other issues like with breastfeeding and stuff. So it was bad. I didn't know I had postpartum depression, but I definitely did in hindsight. And so I went in with the second baby, like knowing those things and being
Mm.
aware and what triggered it. So I just made sure to like just say, "Ah, it's fine."
Yeah. No, for sure. Hold on one second. I'm sorry. My internet just said it was unstable, and I'm like, oh, let me double check on that real quick
Yeah.
so we don't lose internet.
I know I might have to hug
Um,
my mother-in-law right quick. She's leaving.
okay, yeah, go for it. Go for it. Let me check my internet while you do that. Okay, that should be good.
Yes, ma'am. All right, I came back with a special guest.
Yay! Hi, special guest. Aw, hello.
Hey, hi, Cadence.
Hello. Oh my goodness. You're gonna listen to us? Okay, I think I have a better stable internet now. Sorry about that. Okay, if you're comfortable, actually sort of talking a little bit about that, like, um, kind of how maybe looking back, you realize that you might have experienced depression, or with your second experience, like comparing the two, just because I think I experienced the same thing where looking back, I kind of had this darkness for my first, and I didn't realize then what it was. So for people to maybe understand or resonate, like what they might experience to help themselves and others recognize that they're experiencing it, if that makes sense.
Yeah. So pretty much with my first, I tried breastfeeding. And there we go. So let's start with breastfeeding. And every mom wants to be that amazing mom that can produce milk for their little nugget. And my son, when he was born, he was just 2 weeks early. So thank you. He was 2 weeks. She muted me. He was 2 weeks early. Very unexpected. It happened all fast, and we ended up having to do frenotomy. So he was tongue tied.
Mhm.
So we got that handled, and since he was so little, he was a very yes, baby. He was low birth weight, and so he couldn't suck well, and he was tongue tied. So it was a whole lot of issues. And then later to come find out is I didn't, yes, she sees it.
Yeah.
I wasn't a good producer as well. So it was a lot of factors. We went to the doctor a lot in the beginning, and my husband was a teacher, so he went to finish his semester. We had our kids in December. So he finished out, that period, and then he was there for a little afterwards, and so did his mom come. But me struggling with trying to get my baby fed was a struggle. It put me in a really, really, really bad space. And I was okay with formula. I mean, I grew up with formula and stuff. But I just felt like I couldn't do anything for him. Right. And my husband is a jokester, but you're emotionally unstable in that moment and you don't want to hear it. So him saying, oh, that's skim milk, or oh, the baby might not be getting fed right. And it wasn't sexy. It was not sexy. And then he wasn't there. Like, he was there for the 2 weeks of winter break, but not any other time. And I did have other people coming, helping and supporting me. So it wasn't like I was alone. However, I felt alone, like in the inside. Um, and so being that my son couldn't breastfeed like normal, like on the breast, I became an exclusive pumper.
Oh, wow. And that is a full-time job.
That is a full-time job. So literally I felt like if I wasn't holding a pump, I was holding a baby, feeding it milk. So it was just pump, milk, pump, feed, pump, feed, pump, feed. And I literally felt like I could never do anything. Mhm. It was not sexy.
Your hands are just literally full all the time. All the
all
time.
the time because I had, just a traditional Medela. So you had to carry that big old jug around. Well, you couldn't carry it anywhere actually because it was the plug-in type.
Right,
So,
right, right.
so yeah. Oh,
Oh,
here's another nugget.
oh, nuggets are welcome.
And so that led to it. And I would definitely lash out at my hubby. Come here, babe. There you go. I would lash out and stuff. And and I would make sure I wrote everything down so that I would like be angry less, so to speak. But yeah.
So was your yeah, no, I feel for you and I can empathize with a lot and relate to a lot of that. Did you feel like most of your like mental health symptoms were more in that like in like the angry category? Because I think that's a lesser known piece for a lot of women.
Absolutely. It was like resentment.
Yeah.
I was like, I went along with this plan because, having kids at that time was not my original plan. It's because I got a diagnosis, like a life-changing diagnosis, that I decided to go ahead and have kids. So then I just felt angry at the world about it. And then, everything wasn't pretty and perfect like I wanted it to be. And so that was the thing. And then my son had a lot of complications. That like at 6 weeks old, he had seizures and we were
Oh gosh.
hospitalized. So it was a very interesting 12 weeks.
And it's only
Very,
12 weeks. Like I know this is a hot topic for just Americans, but it's only 12 weeks. Like that is not enough
yeah,
time to
yeah.
figure out your own body and like
Well,
what the heck.
they just get normal-ish around 8 and 9 weeks. Like they start to get a pattern.
Right.
And then it's
Or like
like,
a
poof, I gotta
bond.
go back to work.
I know. And you can't I think another thing that's lesser known is that you're not really a lot of times you're not necessarily bonding right away because
Yeah,
they're not aware of anything in the beginning. Like they're kind
yeah,
of we joke they're like little bread dough. Like they don't know what's going. So you're not really bonding necessarily
yeah,
in until like you're about to head back to work and then you're like, I'm
yes.
bonding and now I'm back to work. Awesome.
Yeah, and I do tell new moms, like first time moms, that I said, and it's okay to not love, like, have that,
Like
oh my
the
goodness, my baby, like and
yeah.
snuggling and looking. It's okay to not have that. I absolutely didn't have it.
Yeah.
So it's a thing. It's a thing you don't know. Just like you said, you don't know this baby yet. They
Yeah,
can't
you
speak,
don't.
poo, they sleep and poop.
Yeah. Yeah, and if you think about like a friend or any relationship, you don't know them in the first couple of weeks. Like you have to take time to get to know someone. So, and then did you continue, if you're okay sharing, did you continue pumping like once you returned to work as well?
Yeah, so when I returned to work, since I had my own office at the time, I pumped in my office and it was still bad. And usually your supply cuts when you go back to work because of other issues. And so I decided to well, I guess I didn't decide to stop. I was gonna go at least for 6 months. I didn't decide to stop. My health condition, I had a relapse and they wanted to start medication. And in order to take the meds, you can't be breast or at the time, since it was such a new med, you couldn't be breastfeeding and stuff.
Oh, okay. Oh, I think she muted you.
Cadence.
Wait,
So it decided for me basically. And so yeah, but it was a good thing. Like as soon as I stopped, I felt better. So
interesting. Yep, yep.
yeah.
That's yeah. I'm
So
curious how you feel though about like you've mentioned it a little bit, touched on it, but kind of the world making decisions for you.
mhm.
How did that make you feel, or how did you cope with that kind of scenario?
Yeah, the I guess it wasn't as bad, but I am very selfish, unapologetically. I'm very selfish. And the good thing is my husband is my husband and he is like the primary parent type of person. Like he's like superhuman and can do anything and everything. So I got the person that I needed in life to make this magic happen. So, I definitely was angry in the moment and, having to put my education on hold and go ahead and start a family and things like that. And it turned out to be fine. And we had a lot of issues with our son, with his development. But again, it is what it is. I like to say, Sarah, Sarah, just let it. Yep.
Yeah, I think that's an important just a touch point of like you can still feel and it's still unfair and have feelings. Like you can feel two different ways. Like that that it's frustrating and that you're so, that it's just not fair, but then also it is what it is and keep moving with life. Like you can have kind of both feelings at the
Right.
same time. I think human
Right.
emotions are way more complicated than we give them credit for sometimes. So
Yeah.
like, and two with baby, like if you're not bonding right away or you're frustrated or you're angry at the situation, it doesn't mean that you're not grateful or that you're not in
Right.
love with your baby. I think that's a tough topic for a lot of people too. Like you can still
Right.
be grateful and love this baby, but not feel great in the moment or not feel bonded
Right.
or whatever. So it's okay to feel both or many things.
Right.
Um,
All of them.
all of them, everything. Yeah, because I think you're supposed to be so grateful. So I would start all my sentences with like, I'm grateful and I appreciate my baby. But it's like, yes, that goes without saying. We shouldn't have
Right.
to say that with every
Right.
little. It's not a disclaimer that we
I'm
have to
trying to
like.
trick myself. No, I'm just kidding.
Yeah. Well, or that too. There are times when it's not perfect.
I know.
So do you want to talk a little bit about your chronic condition and
Mhm.
whatever you feel comfortable sharing, but especially like how that affects your physical health and your mental health and what you might have to do differently or the same as moms who are not experiencing what you're going through.
Right. So I have multiple sclerosis. And so that is a degenerative like neuro disorder for anyone who doesn't know. And most, I mean, if you think about someone famous, oh, what's the my cutie patootie? Uh she was the most recent one to come out
Oh
being
shoot.
I know I can't think of her name.
It's not
I
Christina
love
Applegate,
her.
is it?
Yes, it is Christina. Christina
Okay. Yeah.
Applegate.
Okay.
Okay. So she's someone famous who recently came open about it, but like people like Richard Pryor,
Yeah.
I want to say was it Montel? It's other people.
Yeah.
But most times when people think of the disorder, they think of like physical disabilities. And I have had some of those, mine come and go. I have a relapse in form. So even when I dance with you all, 11 so years ago, I had an event, didn't know that's what it was. I wasn't diagnosed back then. But that's why my leg just gave out while we were dancing. And I was on crutches for like 3 months. And literally that was part of my relapse. So with that, it took about 10 years for a diagnosis. So once I got a diagnosis, because mine is cog fog, so I forget words while I'm talking. Um, Yeah, all of that. But it's mostly cognitive, and my physical stuff like comes and goes. So I can be fine one day physically and then the next day not so much and things. So when I got the diagnoses, they wanted to start me on treatment and I was like, yeah, how about no? Because I don't like medication.
As a
Um
nurse.
yeah, I was like, I don't like meds. I don't want to do it. And I was like, I want to give a shot at having my kiddos before I do anything because it's called a disease modifying drug and it can modify some other stuff too. So I was like, God, let me give it a try before let me give kids a try before doing something like that.
Yeah.
And so that is what I did. And so I want to say the following 3, 4 months after my diagnosis, I got pregnant.
Wow. Oh my
I,
gosh.
I got pregnant. And there is life. And my goal was
Wow.
to and fun fact, pregnancy pauses disease progression for
I have
MS.
heard that from lots of different conditions,
Yep.
but yeah.
So if you have autoimmune, so autoimmune diseases usually it pauses when you're pregnant because the body goes into like not survival mode but protection mode, so
Action.
to
Yeah.
speak. And so me and my husband's goal, he wanted 5 kids and I didn't. But he wanted 5 kids. And so he was like, oh, this works in my favor. We could just stay pregnant and that be your treatment. And I talked to the doctor, and he was like, absolutely. He was like, that'll be an excellent plan, but you do have a higher chance for relapse postpartum.
Oh,
Undone.
interesting.
So that kind of led into my postpartum issues as well. And I actually had a relapse. So I had
Really?
a
Okay.
so and that's when they decided to put me on medication instead of me just staying pregnant. And so that's how we got there.
That is a long journey. I don't think like we take for
Yeah.
granted like a diagnosis of 10 years in the
10
making
years, 10
that you're
years
noticing
that we
things.
know of.
Well, right. At least 10 years and of things that you're experiencing that are probably not easy going through
Right.
to not know what the heck was going on and then to get a diagnosis that's pretty life-changing and to have to make fairly quick decisions about what to do with
Right.
your family. And then plus what you mentioned, the cog fog, the brain fog,
Yeah.
that you would get probably, I mean, I experienced a little bit of that just from, or not a little bit, a lot of that from pregnancy, mom
Yes.
brain,
Yes, mom
postpartum
brain. And
fatigue,
that's how I
hormone.
had to explain it to the doctors for them to get it. I said, it's like I have mom brain times 10. And I said, I know you, and they would like think I was joking. I was like, I know you think I'm joking. And I know I haven't ever been a mom, but it's mom brain. And I had to start saying chemo brain too. So I had to start using descriptors like mom brain, chemo brain to
Right.
make them get it because at first they were like, no. And I'm like, yes. I was like,
Oh,
I had been teaching for at least 8 years by then. And I was like, I should be forgetting the words in between while I'm teaching. And I was in nurse practitioner school. It was, mm-hmm.
right. And
Yep.
I was just going to ask about the medical gaslighting or the having to prove
Yeah.
yourself. And
Yes.
I think fatigue and cog fog and those types of
Yeah.
things are so
And
they're
it's
hard to
washed
put.
away. It was washed
Yeah.
away because I've always been anemic. So for years we've always attributed it to my anemia. So it was hard. It
Ugh.
was hard.
Oh my gosh. I think some of us probably can't even imagine, like really
Yeah.
can't even imagine.
Yeah.
Did you do anything like, well, again, I think the mental piece is lesser known about MS for sure. Did you do anything to help like save your energy physically or mentally? Like when you were becoming a mom and, having to figure things out, was there anything that was useful or a strategy that worked?
No, I'm a napper. I've been a napper all my life because of the anemia part. So
Yeah.
I just nap. That's
Yeah,
I just nap. That's all.
I I do too. Still to this day, my kids tease me about that.
Yeah, I love naps. Had a good 2.5 hour one yesterday. That might be considered sleep for some people, but that's my nap.
But you got to do, I mean, you have to listen to your body. And I think in our society, it pushes us to be productive with like
Hmm.
getting all these things done. But honestly, sometimes for our body, with a condition or not, like rest is productive. Like if we
Hmm.
need it, we need it. And
Yeah,
I think it's okay to listen to our body and get what we need.
right.
And you've also touched on a few things that I wanted to point out to folks that might not be in the medical community of self-advocacy. Like you not
Yeah,
only kept pushing for what you needed, but you were very specific about it. Like this is an example of that. It's not just like I'm saying these words, but actually giving you an example. I've taught this class for 8 years and I'm forgetting words. Like
right.
that's not normal.
Normal ever.
Yeah.
Like
So I
ever.
think to anyone out there who's listening to this, being able to
Please.
advocate for yourself is in part, it means not giving up, but in part, I think it's helpful to be really specific. Like the more
And then
specific,
jot it down.
jot it
Like
down. Mhm.
I text myself because of the cock ball because I'm going to
Yeah,
absolutely forget and I'm going to forget where I put it. So I text it to myself with a
great.
like I put neurodoc and then I put everything I need in it so that I could just type in the word neuro and it populates in my text thread.
That's such a
But
great
if you
idea because it's
use
not going to
yeah,
go away. It's right there.
correct, it never goes away. So yeah, I tell people it's kind of like a diary of symptoms.
Yeah, no, I love that idea. You should send yourself like a heart emoji too to be like kind to yourself.
No. Yeah.
No, but I love that. I love that idea. That's a fantastic because using strategies, I think, is well, of course for OT. I'm like, yes, you're using an awesome strategy to make it work for you. But yeah, and that's okay. Like we all use strategies for things, and I mean, I love that so much. Um, I'm trying to think if there's anything else that we wanted to touch on here. Where any other I love to talk about, challenges that folks go through. So I want to ask you if there, I'll kind of explain this first. I want to ask you what challenges you went through either in pregnancy or postpartum, or beyond. And then also moments where you felt yourself shining, like win, things that you're just
Yeah.
proud of and feel good about. So kind of both. You can talk about either or both, but yeah.
Um, challenging was with my first, with all of the, already the feelings, right? The darkness feelings. And but at 6 weeks, being able to identify and advocate for my son that I knew he was having seizures, because
Mhm.
it's really hard to see seizures in a baby, let alone a kid. So
Yeah.
I was able, to advocate for him with that. And we got the treatment and then I was able to navigate um his treatment while he was there and discharged as well because I didn't want him on heavy drugs forever and things of
Sure.
that nature. So it felt good to know that I trusted my gut and followed through with it until we got an action plan going.
Yes.
Um
Yes.
and and I've been like that his whole life, definitely, because he has like autism and things of that nature. And that was a long journey too, fighting with a lot of providers. And I was like, I know what autism is. So it was definitely okay, can I hold you?
What are you
Where did that
doing?
cry come from? Where did that cry come from? They see you crying.
Oh, come back over here. Hang out with us.
And so and kind of the same, like just being able to have a voice. So that's my mom win, because I'm not a traditional mom. So my mom win is just having a voice either for myself or my kiddos, because a lot of times we do feel discouraged like by those doctor people, right? Because they're like, oh no, it's blah blah blah, and it's not that they're downplaying it, but they're downplaying it. So trust your gut and be able to like pinpoint stuff. So
Yeah,
and with Cadence, our breastfeeding journey ended very quickly.
that's
Like I
okay.
knew going in because of how I felt with the first babe. I was like, I'm gonna give it a shot. She was also tongue tied. Um, fun fact, hereditary. She was tongue tied and lip tied. And so we tried, I think we gave it 2 solid weeks. And my pump broke. I didn't have to use my pump a lot, but I wanted to see how much she was eating because she was losing weight, but she was always feeding. And so I just wanted to see, was I still a low producer? And I was, but I was producing much, much more. And she was just you see she's a little juicy, right? You see how juicy she is.
So
Let's just say she wanted a lot more. Uh, So, and I said, and I told myself, I said, that's okay. It's much more expensive. It's not best for baby, but that's okay. So I tried pumping. The pump broke. Both my pumps broke because I was using an old one because I didn't want to commit to a new. I
Right.
don't like wasting anyone's insurance bucks. And so, yeah. And I was like, okay, this is my sign. It is done. We are formula babies. Because I did not have a friend that was local to me that can give me all her breast milk because I have a overproducing best friend.
Oh,
She was able to help out some with Zaylan, but yeah, no, I didn't have anybody to help with Cadence. So
oh my goodness. And I think it's such a I experienced similar things and I think I was going to ask you how you felt about or what advice or like people talk and they're like do this and try this and I don't know, like did you feel like things were done to you to make breastfeeding work kind of thing or
well,
I don't
I
know.
so I went to a lactation consultant. I gave it a true value effort. I tried supplements, the diet stuff. It just was not in the cards for me. When I got the blood work drawn, I guess your prolactin levels, I forget what number you want to be, and let's just say mine was negative 10 of it.
Yeah,
So I
no,
was
that's
like, it doesn't matter what I do, my my levels will be low. So
so
you give me
snug.
kiss.
So
Mwah.
snuggy.
I love you.
I
Mwah.
wonder if
Oh,
that was helpful from a mental health perspective to like know to be given data that's like
mhm.
it's not you, even though because I could tell myself, I don't know, for me, I could tell myself a million times, like it's not me, but I still felt like it was me. So I don't
Right.
know, was that helpful to know that information?
Absolutely. Once I got those levels, I was like, yep. I was like, it's not much I can do. I can continue doing what I want, but it's not much I can do.
Is
And
that
just
something that,
knowing that.
yeah. Is that something that people can ask for, like to do a specific?
Um, I would imagine you could. I got it done like the lactation consultant ordered it. And
Mm,
it's just blood work. So I can
okay.
imagine so.
Yeah, no, that's interesting. I'm like, I didn't know about
Yeah.
that. That's really cool.
Yeah, I see all the specialists. If
Yeah,
you're
I
sick, you come
bet.
and see me.
I was gonna say you were like, so I imagine that a lot of that is fatiguing, let alone like the hormones, the lack of sleep, the, standard
Literally.
motherhood stuff. But like having to advocate is that it is kind of exhausting. Like you're advocating
It
for
is
yourself,
very,
your kids,
yeah,
everybody.
very exhausting.
I love your journal idea. I kind of want to use that for myself, even though my kids are older, but I love that. I feel like that's a place to not only like put your feelings, but to help process your feeling, not
Yeah,
your feelings, but your experience. Because I think in motherhood, we don't get a lot of time to process anything. It's
right,
thrown at us. We don't have time to process our body, our baby, the bond, everything that's going on, our mental health.
right.
So I'm curious if you felt like that. I feel like that helps you sort of have a place to process.
Yeah, it's just and so I don't like process it. I don't go through the feelings. What I do is I just brain dump. So I
Yeah.
like it because I don't have a lot of space in my brain to be thinking about other stuff.
Yeah.
Like
Yeah.
it only works a little. So I call it brain dumping. Literally, it's like are you a Harry Potter fan?
Yes. Yes. Yes.
Okay, so you got your little pensieve and how you take it
Yes.
out
And you're like,
and put it in. That's what I do. That's
I
what I
can
do.
picture the little thread coming from your brain and being like, boop.
Yes. And so that's what I call it, brain dumping.
Yeah.
And sometimes like if I like to reflect, I'll turn back and look and I say, "Oh, that was a bad spot. I'm so thankful not to be there anymore." Like, I do like to reflect. Like literally I do that in my work life too. I've had one, so I've been in my current job for 9 years and I've had one since year one. And every day, like I have all my stuff in there. So
Wow. Oh, that's a great concept. And I think along those lines, as an OT, I'm going to throw in my little tidbit of what I love about that too. Cause I think when I see patients or clients, in my motherhood business, but also in the hospital, it's hard sometimes to be like, you're doing better, but a lot of times you can't in that moment, like
see it.
flashback and compare anything
Yeah.
because you're just like, no, I'm not. Or, any longer term journey is kind of hard to see like
Right.
where you were. So I think it's helpful, even if you write something down once a month or once a week to be like,
Right.
I am in 10 out of 10 pain today, or I'm 10 out of 10 tired or something. And then some kind of little fact about yourself that later on you can look back and be like, oh,
Right.
I haven't had that much pain in a long time, or I forgot that that's what I was going through, whatever it
Right.
may be. So I
Right.
think that's a really helpful tool to be able to look back and reflect and recognize what's the same and what's changed and, that kind of thing. Give yourself feedback almost. So, yeah, well, in conclusion, I'm curious how you feel sharing your story. Like, how does this process feel to you?
It feels good. I always just try to, shed light because like I said, I'm not a typical mom. And between me and my baby's diagnoses,
Yeah.
we occupy a lot. And yeah, and this little nugget right here was the one that almost took me out with my
Girl.
postpartum. Yeah, I had a postpartum hemorrhage with her.
Oh my gosh.
So yeah, I have eventful pregnancy, darling.
Good things. And I hope it's helpful for you to share, but I also hope it's helpful for other people to hear that the more stories that come out, that a lot of us, many of us, maybe all of us don't have what we think of as a typical experience. It looks so glamorous sometimes with pregnancy into birth and all
I
these things,
know. And I'm like,
but
now
we all have our things that have happened and
we
but
are captive. It's
yeah.
okay to be held captive for that transition period.
Yeah, it is. It's a huge transition. It's one of the biggest life transitions out there, and we don't talk about that enough. So I'm so grateful for you sharing it because the more that I think other women too hear that it is a huge transition, and again, not to scare anyone, but just to reinforce and
Prepare.
validate. Like if
Just
you're
like
going through something hard, it's hard sometimes. It's really
yeah,
hard.
yeah.
So yeah, is there anything else you want to share, or I don't know, before we wrap it up?
Um, no, I don't think so. Maybe I didn't exercise, so exercise. Even
Even
if it's
walking.
even if it's just walking, holding the baby or something, just stay active. Because I didn't do that much at
Okay.
home.
Okay, fair enough. Fair enough. And yeah, even walking around is good. I put the stroller in my house sometimes and just walk in my
And
house.
just walk around in it. Yeah, no, my nuggets,
Yeah,
they
it's a
were
lot.
held hostage.
It's a lot. It's definitely physically and mentally a lot. So that's okay. That's good advice. I love it. I said it before, but I wanted to say one more time, thank you so much, Akila, for joining us and for sharing your journey and your truths. Your story matters and you matter. And thank you so much.